Natwampane
ay 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 tuvwange
ay 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 natwampane
ay ay ay
Hello again and welcome to the 7th conversation in the series of talks that we've been having around the global minimum standards for GBV. We're talking about programming, response and prevention. My name is Wada Malama. I'm coming in from GIZ, and with me today I have a panelist of ladies coming in from different organizations. I have with me here Priska. Priska is coming in from Ngombe One Stop Center as coordinator. You're welcome, Priska.
Thank you very much.
And I also have with me Sandra. Sandra is coming in from Ministry of Health. You're welcome, Sandra.
Thank you, Willie.
And I also have with me Dr. Wupe. Dr. Wupe is coming in from Ministry of Health as well. You're welcome, Doctor.
Thank you.
And so today we're going to focus at looking at health. As you heard, the vast, the richness of the panel itself. We have a lot of health coming through. So we'll be talking around health aspect and GBV. So as we know that GBV survivors are most likely to acquire services, health services, I was just wondering if I could find out from the panel what kind of minimum health services a GBV survivor is required or would be able to access.
Okay, thank you so much, Polly, for that question. The number of health services that a survivor is expected to receive in a one-stop center or a health facility.
Yeah.
So depending on how they present, some will come with physical injuries.
Mm-hmm.
So we'll need to care for the injuries, for the physical injuries, ensuring that they are treated,
Yeah.
they are dressed, and they don't get infected.
Yeah.
Because if they get infected, sometimes that can really be bad for the survivor, and
Yeah.
it can cause a lot of problems.
Yeah. Yeah.
Secondly, we also need to test them for HIV, particularly those that come with sexual assault or sexual abuse.
Absolutely.
Because we do not know the people that may have abused them.
Mm.
So when they come, we test them for HIV.
Yeah.
And if they test negative, we put them on post-exposure prophylaxis.
Yeah. Yeah.
Then we also have emergency contraceptive, which we provide to survivors that have been sexually abused.
Yeah.
This is basically to prevent unwanted pregnancies. Particularly teenage pregnancies can have a lot of negative reproductive health outcomes. So it's just fair that they receive emergency contraceptive to prevent the pregnancies. We also have screening for STIs and prophylaxis management of sexually transmitted diseases because if someone has been sexually abused, they can contract STIs.
Yeah.
So we can treat the existing STIs as well as prevent the ones that may have been transmitted in the process.
Yes.
Yes. Then we also have psychosocial counseling, which is also very important for any type of gender-based violence.
Yeah.
Because regardless of whatever it is, be it physical, be it mental, it still impacts negatively on someone's mental health.
Absolutely. Yeah.
Then on top of that, we also screen for hepatitis B virus as well as prophylaxis.
Yeah.
We also ensure that their safety is well taken care of.
Absolutely. Absolutely. Yeah. And Sandra, so these services are free, isn't it?
Yes. These services are free, even when someone comes with physical injuries that may need an X-ray to be taken so that the doctors that are attending to her can be sure of whatever the impact the injuries may have. It's free. In the health facilities, this is a service which is paid for.
Yeah.
But if it's a GBV survivor, we do have a memorandum of understanding where they are not supposed to be charged anything.
Absolutely.
So even their X-ray is free. Absolutely.
Okay, thank you so much for highlighting that. So if we talk about, I heard you mention one-stop centers, and I understand that Priska, you're coordinating Ngombe one-stop center. Would you be able to describe to us how the survivor accesses these various services from a one-stop center? Would you run us through how a one-stop service center functions.
Thank you very much, Vivian. A one-stop center, like the name itself, it's a building which has a lot of services in it.
Yeah.
So we have different staffs that are stationed at the center.
Yeah.
We have the paralegal who provides legal advice to survivors of gender-based violence. We also have a VSU officer, that is the victim support officer.
Yes.
He's a police officer who provides safety and security to survivors of gender-based violence. And also we have a psychosocial counselor or counselors who are trained and certified under Counseling Council of Zambia. And we also have an information officer who is also a data entry clerk who enters the data or information of a survivor who comes to the one-stop center.
Yeah.
So the information officer enters data both through the electronic system and also through hard copies.
Yeah.
And also we have the nurse.
Okay.
Yes, who ensures that the medical services are provided to the survivor of gender-based violence.
Yeah.
And also, this nurse also coordinates with other nurses or other health workers in a facility.
Okay.
We also have a driver. Yes, a driver is a very important person also, in the sense that he helps or she helps in facilitating survivors of gender-based violence to relevant services of referral.
Okay.
Yes.
Okay.
Yes. So on the staffs, I think I've covered that. But when it comes to the services that are provided at the one-stop center, each staff has got his role or her role to play. So when a survivor of gender-based violence comes to a one-stop center, the first person he or she will meet is the information officer. Yeah. Where the details are going to be gotten, but we should bear in mind that when getting information from a survivor, we need consent.
Okay. Okay.
The survivor has to give us consent to go ahead to assist her or him in cases of rendering support. Okay. So when the consent is done, then we go ahead with the provision of services. The nurse or the coordinator at the one-stop center will assess the case that has come to the center. Is it a critical case? Does it need urgent attention? Yeah. Or maybe it needs referral to other relevant services. So with that, we'll be able to provide or triage, the case. If it really needs critical counseling there and then we'll be able to provide crisis counseling to this survivor. Yes. And then if it really needs medical services whereby the survivor is injured and or maybe the survivor has been deferred and really needs urgent attention, then there and then we'll provide emergency services, medical services to the survivor of gender-based violence. Yeah. Also, this survivor will need to undergo counseling. Okay. So that's another service that we provide. Like I said, we have trained counselors who provide psychosocial counseling. And it also depends on the type of psychosocial counseling that will be provided to this survivor. And if it needs trauma counseling, we have the counselors who have undergone that training. Then they'll be the survivor will be provided with trauma counseling. Is it child counseling? The child will be provided with child counseling. Okay. Is it family counseling? Yes. Yeah. And also maybe a GBV prevention, of survivors. So it depends on the type of case that has come, and then the psychosocial aspect will be rendered upon.
Yeah.
And also these survivors need to undergo legal. Okay.
Yeah.
Most of the survivors that come to the one-stop center, they don't have much knowledge or information on the legal part. So it is the responsibility of the paralegal and also of the VSU to sit down with the client and try to explain to them about the proceedings of their case.
Yeah.
Yes. So the VSU officer will work hand in hand with the paralegal to see the case has been processed, and if it really needs to be referred to other relevant services for legal action, then the staffs responsible will be able to take up the case.
Absolutely.
And the other services that are so vital in a one-stop center settings are the community activities. We need to provide community awareness on GBV. Yes. In order for us to work hand in hand with the community, we have community activists who are stationed in the community who helps us to identify cases of gender-based violence and they refer them to the one-stop center. And also, as a one-stop center, we do conduct community activities such as mobile outreaches and also door-to-door in order to spread the information of gender-based violence in the community.
Absolutely. That sounds like you have an exciting job, Priska.
Yes, it is.
Thank you so much for that information that you provided. The Ministry of Health is doing so much more to contribute to prevention of gender-based violence itself. So, Doctor, would you like to come in to just give us a little bit on what other aspects that Ministry of Health is working towards addressing the prevention as well as the response to GBV?
Of course. Thank you. And that's a very important aspect that actually is almost always neglected, so to speak. Yes, or not seen, not visible. We get to see the treatment aspect of it. But I think I've always been a believer that it's better to close the tap than get a good mop and be mopping a wet floor. So prevention comes in the closure of the tap. If we can stop these things, then we'll put a less burden on our healthcare system.
Absolutely.
On our funds in buying commodities and drugs and all the aspects of trying to manage a case. It's actually quite expensive because I think you've heard, look at how many officers are involved, how many services are involved, and all those require funding. So if we could do better by, and also we know that with our funding system, these are not sustainable. There'll be times when commodities do run out. Then what do we do? So prevention will play the role in trying to prevent all that or alleviate that that burden so that we can do that part. And Ministry of Health is actually looking at prevention. And one of the things they're doing in the GBV space is raising awareness. And I think, as Priska mentioned, we're doing this through community. We've seen that in terms of the healthcare workers, we've pretty much trained almost all and are pretty conversant with managing a case. Of course, not perfectly, but at least the basics, providing the basics or the minimum care or package. But we've left the community out in the response. So we've been looking at ways to bring the community on board. So we've been providing trainings to traditional leaders, church leaders, all the community leaders, so that they too can start these conversations in the community and therefore prevent. We also use them because they will be our whistleblowers. We know that in Zambia there's sort of like a way in which we deal with these cases. We choose to sort them out as a family. To discuss outside court, withdraw cases because it's a family matter, with a little bit of exchange and So we're trying to raise awareness in the community to say that that's not the right way to go. These matters should reach the end. Justice must prevail. And withdrawing from court is not the best option.
Absolutely.
So we've been engaging the community. That's one thing we've been doing. Another thing we've been doing is sensitizing in schools. Going around, because most children, most people do not even know that they're undergoing abuse until somebody tells them that actually that's abuse. So we've also been going around in the schools, learning institutions, educating them about what GBV is, so that they themselves will analyze and say, oh, I'm a case. and they present forward. And I think in my years of practice, I've seen that happen, where most children came after a group had been to their school and they say, oh, you know what, that's me. And I think I need help. So we've been going around in schools. That's another thing we've been doing towards prevention. Another thing we've been doing is also we've been doing what we're calling a multidisciplinary management. This is where we are educating the police, the legal officers, starting from magistrates to high court judges, and anyone in the legal system, so that we all speak the same language. And even if a doctor should present a case, the magistrate, the police will all understand what it's all about, and we'll manage it the same way. Our understanding about the gravity of the case will be the same. So those are some of the things that we've put in place as well. And of course, we've been currently undergoing discussions of developing a workplace policy to look at sexual harassment. Because we've identified that for women especially, this is also another way that a lot of them are being abused in the workplace. But we know that most private international institutions have a workplace policy, but as government, we do not have one to govern most of these institutions. So that's also something we're working on as a way of prevention. So that and a few other activities that we've put in place is a way that we've seen is a way to prevent this. But another aspect that we also left out is we looked at our disabilities, people with disabilities. They also have been sometimes marginalized when it comes to most of our health responses. So we've also been having integrated meetings with them on seeing how do we service this population. I think statistics and data has shown that girls with disabilities are 7 times more likely to be abused, than an able child. So what is it? What's happening? Is it the caregivers that are the problem? Is it the families? So that also is another area that we're slowly tapping into in terms of prevention of gender-based violence. And an interesting fact that we've done in this community is something as simple as learning sign language. We've noticed that a lot of those who are speech impaired, cannot communicate when they've been abused. So even looking at areas of should we then introduce speech therapy, or not speech therapy, but sign language, in our starting from med school, so that as you qualify as a doctor, you are able to do sign language in nursing school,
even the basics,
even just the basics, nursing school, in all healthcare workers. This is something we should put in our curricula so that we do not marginalize anyone and we do not send anyone away. So these are some of the avenues that we're exploring in terms of preventing gender-based violence.
Okay, thank you so much for that, Doctor. Speaking of sign language and how you would want to integrate sign language into the curriculum, that's a wonderful idea. I was wondering, however, Priska, if you already have something like that around the one-stop center in terms of coordinating with, could be even schools, for example, that are experts in sign language. Maybe, is that something that you were working with, or?
What I can say is that we usually find challenges in cases where a survivor is then dumped. So communication is really a challenge. And you find that you don't know anything about sign language. Maybe all of you at the one-stop center, no one has undergone sign language training. So to communicate with a survivor, it's really a challenge. But what we have come up with as a center, we have tried to engage a sign language teacher. Yes, from a nearby school. What it is that not so many of these survivors of such disabilities usually come to the one-stop center. So if we encounter one, we try to call her so that she can come and communicate, give us the information of that survivor, what really the problem is. So I can urge maybe our stakeholders, even Ministry of Health, to just ensure that maybe staffs from the one-stop centers undergo such trainings for us to really communicate to such survivors. It's really a challenge.
Absolutely.
Yeah.
Thank you so much. The good thing is we do have Ministry of Health here, Sandra and Dr. Rupe, who are here. So we definitely already know that that gap is already being addressed by virtue of just discussing it on this platform.
No, actually, Walia, we have already started something on that.
Okay.
We have developed training manuals for disability inclusiveness in SRI, HIV, and GBV.
It's wonderful.
We have just started rolling it out. And by the way, this this manual is going to be also rolled out to training schools. It's been included in the nursing curriculum. And going forward, the pre-service nurses that are training to be nurses will be graduating with this skill.
That's wonderful.
So we've not done so much yet, but the process has started.
I think starting is always key. As long as the journey of the first 1,000 miles begins with the first step, something.
Yes.
So I think
a lot of nursing schools are now orienting their students with that.
No, thank you so much, colleagues. Thank you for taking the time to come through and just educate us about what Ministry of Health is doing in response and prevention, and also to learn about the coordination that is going on at the one-stop centers. This has been a wonderful discussion, and I hope our viewers have managed to capture one or two things to learn from our colleagues from Ministry of Health. Thank you once again, and we hope to see you soon.
Thank you.
Thank you.